Welcome to the Rocky Mountain MS Center's webinar series, Maximizing Lifelong Brain Health and MS. Today's topic is mental health and MS. This presentation features Alissa Berlinger, a licensed clinical social worker and MS educator. Alissa has been involved with the Rocky Mountain MS Center since 2010 after being diagnosed with MS. She received her master's in social work from Smith College School for Social Work, and she completed a 2-year clinical fellowship at the University of Colorado Boulder. Through her role with the Rocky Mountain MS Center, she teaches MS 101 with Kelsey Lance and provides therapeutic support for individuals, families, and loved ones who have been impacted by MS for the Rocky Mountain MS Center. Outside of her work for the Rocky Mountain MS Center, she is in private practice in the Denver area. This webinar is scheduled for 1 hour. The first approximately 45 minutes will be the presentation. If you missed something on a slide, we will be archiving this webinar on our website, www.mscenter.org, so you can replay it at any time. We'll reserve approximately 15 minutes at the end to answer questions from the audience. You can submit questions at any time during the hour by typing them into the chat window on your screen. We will answer as many questions as time allows. Today's presentation is for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. With that, we'll turn it over to Alissa.
Thanks, Kelsey. So today we're going to look at MS and mental health. We know mental health is a pretty large concern with individuals who have MS, and what we're going to go over today is we're going to look at common symptoms for anxiety, common symptoms for depression, how MS can impact these symptoms, and strategies for one to consider, to help manage these symptoms that one might have. So according to the National Institute of Mental Health, approximately 1 in 5 adults in the United States lives with a diagnosable mental health condition. So if we put that into numbers, that's about 46.6 million individuals. These challenges vary in degree and severity. They can range from, mild to moderate to severe. So anxiety disorders and major depression are among the most common mental health symptoms in the United States. The lifetime prevalence of anyone having an anxiety disorder is about 31.6%, and the number of U.S. adults living with anxiety disorders is 42.5%. So when we talk about anxiety, we're also looking at, anxiety has a very broad range of things, and we'll talk a little bit more about that in a minute here, of what that looks like specifically. The number of U.S. adults impacted by major depression each year is 17.3 million. And of these individuals, over 56% of adults with mental health struggles do not receive any sort of mental health treatment. So our hope here is to talk a little bit more about treatment as well. So anxiety. Stress is a normal proportional reduction. Stress is normal. We're all going to have stress in our life. It's just part of the human condition. But sometimes we can have a proportional reaction to what we have and what we experience. And then when we don't have that proportional reaction, that is when we have or experience anxiety. So it's characterized by feelings of apprehension, unexplained thoughts of impending doom, and or excessive worry that is difficult to control. So the way that these symptoms can show up is, feeling restless, feeling really tired, having difficulty concentrating, losing one's trains of thought as you're trying to communicate and talk with others, feeling really irritable in your day-to-day life. It can also manifest physically, so having muscle pain, tightness, feeling just sore. And the other way is sleep disturbance, so difficulty falling asleep, staying asleep, waking up feeling not rested, being restless in your sleep, and dreams actually could also play a part of anxiety with sleep disturbance. And so when we think about depression, there's many things that can contribute to depression. It's often described as an extended period of feeling low or feeling some sort of disruption in one's ability to enjoy life to its fullest. So, biological concern. So that actually, MS can be a biological concern and a cause for depression. Maybe some cognitive stuff that can also go along with MS can cause depression. Depression can be more prevalent in women. Not always, but we will see that more often, sometimes be diagnosed in women. It can also have, a co-occurrence. So maybe having MS, we'll see depression be a little bit more. We'll see depression more frequent. Certain medications can cause depression. There can be a genetic predisposition to it. Situational, circumstances in one's life. So getting diagnosed with MS, other life changes or transitions can also cause depression. Common symptoms that we see when people experience it. So, feeling sad, feeling anxious, feeling empty, sleep disturbances as well. So sleeping too much, sleeping too little, reduced appetite and weight loss. Or you can also see increased appetite. It can go both ways. Loss of pleasure, that's probably one of the more common symptoms of depression that we see. So just not feeling ready to go, not really getting joy. The things that you used to enjoy doing no longer bring you purpose, don't fulfill you in the same way. Feeling agitated, feeling restless, feeling irritable. So physical symptoms that also don't respond to treatment can be, racing heart, muscle stiffness that we talked about earlier, that can all be part of depression as well. Another thing is, making decisions can be really challenging, having problems concentrating, remembering what you're supposed to do. Fatigue or memory loss is another common symptom we see. Feelings of guilt, hopelessness, or worthlessness, and thoughts of suicide or death is another common symptom. So what do we do with this? How do these manifest? What do these show up with people who have MS? So over 70% of individuals have MS report symptoms of depression and anxiety. There's multiple see this, but the common places where we see is that, these can be symptoms of having MS. It can be caused by the uncertainty of having and living with MS, but it can also be caused by other underlying pre-existing concerns. So when we think about treatment with MS, it really doesn't necessarily, the origin isn't always as important. The origin is important when you're doing your therapy, but, if the anxiety depression is caused by the MS, or did you have anxiety and depression first and then get MS, that's not what we're always interested in, because the treatment will look the same. So when we think about, how does anxiety and depression show up for someone who has MS? So some of the bigger ones are intense worry and or sadness about the one's disease course, not wanting to engage in normal social activities, not wanting to go out with your friends, not wanting to go on, excursions with your family. Also, maybe not wanting to tell your family how you're feeling, so withholding of information out of worry or concern of it being too much for them to handle, or worry or concern of how they might take, information about how you're managing your MS. That can impact it. A worsening of symptoms. So I've often see in some of my patients that I work with, their symptoms can be worse when they're feeling more depressed or feeling more anxious. So their spasms might be heightened. Their fatigue might be worse. Their sleep issues might be worse. And so those are all common MS symptoms that we see that often can also get worse when someone's feeling depressed or feeling anxious. As I was mentioning, so increased fatigue, concentration, and sleep can also be impacted by these symptoms. And another important thing that we don't always realize is that actually ambivalence around treatment, whether it be a disease-modifying therapy, symptom management therapy, steroid therapy, ambivalence, should I do this, should I not, that can also be part of having, anxiety or depression and with having MS as well. And the other thing that we often hear is someone being really easily irritable, so really just kind of getting upset or not as patient with family members or loved ones or even just strangers as they would like to be. So some considerations to think about kind of as one thinks about managing anxiety, managing depression is, when someone is diagnosed with MS, there's a mourning and a grief process that one goes through. So the initial, diagnosis process in and of itself, it's grappling with the unknown. I really believe that the unknown is one of the scariest things that just us as humans have to deal with and grapple with. And being diagnosed with MS makes you come front and center of having to face the unknown day in and day out. You just don't know what may happen day in and day out. So learning to kind of grapple and sit with just the unknown of the disease course and the disease process. And kind of when you think about the mourning and grief process, there's kind of different parts that I think about. So the initial diagnosis. What does this mean? And I really believe being newly diagnosed is usually like the first, 0 to 5 years of, the disease course. It's not something that it's just you get the diagnosis and then it goes away. It's, grappling with what does this mean? And it can take, I'd say, a couple years, 5 years usually, to kind of really make meaning and make sense of what does this mean to have MS? What does this look like? What does it mean to each individual person? And then, as, age, natural aging, people get older, there's kind of the middle stage process of, dealing with, grappling with what MS is. You might not be doing as well as you used to be when you were first diagnosed. Natural aging, just, in terms of just from the biological sense, what it does to the brain plays a big role in how one might continue to manage and deal with having MS as they age. And then, the next process kind of is the end of life process. What does it mean? Just I think as natural aging has something to do with that, but then you add MS onto that, and what does that mean? What does that look like? We think about ability, disability, just cognitive issues, other things that can come just through the natural aging process, and you throw MS into that, and it can definitely throw a wrench in things, and it's definitely a different grief and mourning process. One other thing that I like to think about when I think about mourning and grief is really it's this idea of change. And as humans, we really don't like change. It's probably one of the most uncomfortable things that we can do. We will continually try to make change, and it won't last, or maybe will only last for a few months, maybe a couple years, and we'll kind of slowly find ourselves back to where we used to be. And a lot of that is grappling with how uncomfortable change is. We like to there's this word that we call homeostasis, and we have this propensity to go back to what we know, whether we're even aware of it or not. And so kind of wondering what that looks like and means like as we grapple and mourn with what's always constant is change, and MS changes who we are and how we can be and how we relate to the world. So really making room for that is important. Another idea of, what does acceptance mean around what is MS? And so this is individual for every single person. A lot of it has to do with our own identity, our sense of self. And when I think about this idea of acceptance, it's not necessarily that we always approve of it, but it's making space and making room for being uncomfortable with having this disease, making room for not knowing, for the uncertainty. And when we can make space for that, it can allow us to be able to accept it and then move forward and not necessarily be held back so much around MS and what it means. And then I mentioned this a few minutes ago too, but just this idea of aging and natural aging. It's the one thing that if we could really change and slow down the disease course, it would make a huge difference in the disease course. But unfortunately, we do not have the ability to change the natural aging process. But that does also influence how MS shows up. One might be fine for 15, 20 years with their MS symptoms, but just because of the natural aging process, the brain's inability to wire and pick up and rewire functioning like it used to be, that can definitely influence the way that MS shows up. So it can cause more anxiety because you just don't know day to day. Things aren't how they used to be, and that can be a big challenge sometimes. So what are some ways that we can manage and deal with all these different considerations and things that we've been talking about, in particular around anxiety and depression? I'm a big believer and proponent in psychotherapy. So psychotherapy or talk therapy is a way to support people with a broad variety of mental health and emotional challenges. So you don't necessarily even have to be at the place where you have a diagnosable mental illness to be able to benefit from psychotherapy. I believe people in all spectrums and ranges and places in their life can benefit from use from psychotherapy. So the goal is to help eliminate or control troubling symptoms so that one can function more fully and gain and increase overall well-being. Another way that I like to think about what psychotherapy can be is it's a way to kind of gain insight, awareness, and understanding of how one moves through and interacts with the world around them. When we think about MS in here, it can be a big strain on interpersonal relationships, and therapy can be a really great space to kind of get some feedback, get some support around managing interpersonal relationships and stress that can come from dealing with MS. Psychotherapy is often used in conjunction with medication to treat certain mental health conditions. So research shows that some of the biggest benefit of medication is actually you'll get more benefit when you are engaging in psychotherapy with the medication versus just medication alone. So something to consider. So I hear this often of, well, where do I even start? How do I find a therapist? Where do I start? And talking with your primary care provider, your neurologist are really important people. Are there other care providers that are out there that who you trust that might be able to refer you to someone? A trusted family or friend should be able to also help. And then the other piece is, if you can look online, but just being an informed consumer about who you connect with and where you're getting them. There are, a ton of different resources out there. Not all of them are. Not all of them are going to be. Just finding someone who's licensed is really important, and where they are, listed is important as well. When we think about, when I mentioned this idea of being licensed, certain states, they have this thing where not all mental health providers have to be licensed. And so finding a licensed provider is really important. So as you're looking probably through, there are going to be different types of providers and licenses out there. Really the biggest thing has to do with some of the training that goes on. At the end of the day, all of these providers are really doing something that's very similar. So psychiatrists are medical professionals, so MDs. There's also mental health nurse practitioners, and those are responsible for prescribing medications. They mostly do medications. They do not normally do talk therapy. Some do. Licensed clinical social workers, psychologists, LPCs, licensed professional counselors, licensed marriage and family therapists, and then there's certified addiction counselors as well. So there's lots of different types of providers and licenses. The biggest difference is their training, but at the end of the day, everyone really does the same thing. So something to kind of think about is, oftentimes I hear, the biggest barrier is a lot of providers don't always take insurance, but insurance is one way to be able to, pay for treatment. Another way to think about it is most therapists will offer a sliding scale or be able to kind of work with you on finding a reduced fee that works. There are a lot of community clinics out there that people can access and be able to get in and use insurance in that way. Universities are a great place to go to. Most of the training programs have a community clinic, and it's a really great way of being able to get affordable mental health treatment and care from individuals. They are in training, but they are supervised by professionals, and I think that's a really great benefit that people aren't always aware of as a way to be able to access care. So oftentimes what people want to know is, so I found someone, but what do I ask? How do I know if they're going to be, worthwhile or beneficial, or is this going to be working for me? So some, questions to consider are different areas of expertise and specialty. Does this provider have familiarity with chronic illness and what that is and what that looks like, and some of the manifestations that may go along with managing having a chronic illness, and how that can show up from a more psychological way. What's someone's approach to therapy? What types of treatment do they offer? There are tons of different therapies that are out there, and there's tons of acronyms. I'm not going to get into all the details on them because it's incredibly confusing, but I think you can ask them what their approach to therapy is. What types of treatment do they offer? What does that look like? Some people do more skill building. Other people do more insight-oriented. It's really trying to figure out what works for you. Some providers are full, but they might not be able to take new clients, but they may have a referral for you for someone. So, asking if they don't have availability, asking for a referral to someone that they trust. Up front, you can ask what the fee schedule is. That's also important, so it's not a shock to you, and to be able to support you and help you in getting the support that you need. There are tons of different treatment modalities available, as I just mentioned, and one might work for you and one might not work for you. And so I always say these things do not just appear overnight, and they're not going to just go away overnight. So it's a long process. It's not going to be resolved right away, and just being patient and persistent as well as finding a good fit is important. So what are some things that, someone can do right now to try to help manage some of these symptoms of depression or anxiety that they may be experiencing, things that are going on? And one of the biggest, something that we can always all work on, is this idea of mindfulness. So mindfulness is not just sitting there and necessarily having to meditate or do things of that nature, but mindfulness is just being able to be observant, to notice, okay, what is happening? What am I feeling right now? And it's this idea also of accepting what you feel. It's not judging what you feel. It's just accepting it for what it is. And so there are tons of different mindfulness apps that are available on your phone, resources available, just to it's more about slowing down and just noticing what's happening, what's going on, what you're feeling, especially in these moments when we can feel very overwhelmed. Another important part with mindfulness is actually the breath. And so when one is feeling anxious or feeling overwhelmed, focusing on the exhale is actually really important. It's through the exhale that actually can calm the nervous system, which is what can sometimes be going on when one's feeling anxious. Their nervous system can be a little revved up. So focusing on the exhale can actually be really important with that. This idea of healthy vulnerability. So it can be really scary to say, hey, I'm feeling really anxious today, or I'm feeling depressed. I do not feel good right now. So being able to actually take a second and communicate, how you're feeling to supportive people, to loved ones, to even just your healthcare providers, being honest and taking that step of being vulnerable and talking about what's happening can actually really pay off. And so part of this communication is being able to say, all right, how do I communicate what I'm feeling? We might not always know what we're feeling. We might not always know what's going on, but trying to figure out, how do I ask for what I need? That can sometimes not always be an easy thing to do, but even just to say, hey, I know I'm not feeling great, I'm trying to figure out what I need, but to be able to just even say that out loud can help figure out what it is that you need to be able to get the support that you need from others or people around you or professionals as well. Another thing to think about with communication is really paying attention. There are times when it's not always good to have some difficult conversations or communicate certain things. And sometimes when I think about this, we think about when someone's in pain, if we're hungry, if we're really angry, if we're feeling lonely, or if we're feeling tired. It's a part of the mindfulness is checking in. Are we feeling any of those things right now? This might not be the time to try to have some difficult conversations or talk about what it is that's happening and what's going on. But we have to pay attention to what that is and what's going on and how we'll respond if we're feeling some of those things. In particular, pain's a tough one because sometimes it's inevitable. We might be feeling pain, but being able to say, hey, I'm in a lot of pain today, and I still need to talk about this is something that's really important. Clarifying values. This can be a really challenging one, especially when you get an MS diagnosis. It can really shake your world upside down of what does this mean, what's important to me, who do I want to be, how do I want to be, what is my identity with having this chronic disease, and really trying to figure out what is it that you need, what do you want to prioritize. And this can be a big challenge. Oftentimes it can be really scary sometimes to say no, but realizing, okay, no can be a complete sentence. It doesn't, you can just say, no, I can't do that right now. But it's also important to think about, am I saying no because I don't want to feel something that's really uncomfortable, or am I saying no because, no, I can't do this right now, and it can be also empowering. So that can be a tricky situation, but something to pay attention to and to think about around, what's meaningful and what's important to you. And the other part with that is also, working with, support people, families, loved ones around, figuring out what you need to prioritize in a certain day. So maybe you are having a rough day. What are the things that you need to prioritize and do? Along the same line, too, some of these things can be really counterintuitive. So when we're actually feeling fatigue, if we can actually push ourselves a little bit more, we can build some of that endurance, and we end up actually doing a little bit more, and we will feel better oftentimes when we're done with it. It's not to sit here and say, you often read, oh, just go outside and exercise. That's not what we're saying here. This is more around trying to figure out, what is driving, some of these feelings of fatigue or anxiety or depression, trying to navigate some of that. The other thing that I really like to think about is there are so many different techniques, modalities. Every single person you talk to will have a different idea or opinion. I meant to mention this earlier, too. Oftentimes when we think about therapy, it's not necessarily, you're not going in for advice. and my advice is not necessarily going to be one that's going to be helpful for you, because my experience is different from your experience. And so therapy shouldn't be about going in and seeking advice from someone. Therapy is about, this is what's going on, and the therapist should be able to support you and help you to figure out different tools and strategies to manage what's happening, what's going on, gain some insight, understand what it means to you. So with that, things might be said or put out there, but try it on. I always say, if it works, great, use it. If not, try something else. There's so many other things and options and abilities and just ideas, views, techniques, things to do. Just be a mindful consumer around what you try on, what goes on, what's out there. So with that, I'm going to open this up for some questions, see if anyone has questions, concerns, things that we can address.
Thank you, Alissa. You can type those questions into the chat window on your screen. While we wait for folks to chime in, Alissa, one of the strategies that you mentioned a lot at MS 101 is having humor.
Yes.
Do you want to touch a little bit about that?
Yeah, so I believe humor is one of the most important things that we can have. Having MS, dealing with anxiety, dealing with depression, it can all be incredibly heavy and really challenging to deal with. And if we can find some grace, find some humor in how messy it is, I'll share a story about myself. And I share this often in our MS 101 classes. When I was first diagnosed, I was in a store and I fell and I couldn't get up. I was mostly embarrassed, but also a lot of it was my MS, and I just didn't know what to do with myself. The sales associate came over, tried to help me get up, and I couldn't get up, and so she left me alone, and I composed my thoughts. I got myself together. I went up and I went over and was like, hey, I just want to let you know I have MS and I fall sometimes, and that's just what happens. And she was like, oh, I kept thinking you said you were a mess, you were a mess, you were a mess, not that you have MS. And I take this story with me often, and I think about it even when I might have some rough days, just of how, how things can get mixed up and mistranslated, and yet the humor with, we need to laugh because MS is messy. It's not clean always. And so when we can find some of the humor in the mess, it can help us also manage and navigate anxiety, depression, and all these other things that can go along with MS as well.
And then one more point, you mentioned mindfulness as a strategy. Can you also touch a little bit on the effects of stress on depression and anxiety?
Mm-hmm. So when we have stress, our body first. And so when we are, MS in particular with stress, so we are going to, our brain's not going to be able to pick up and rewire function and work as well as we would hope that it would be able to do when we are stressed. So if we're stressed too, we're going to feel more anxious, we're going to feel more depressed, we're going to feel more overwhelmed when we are feeling really stressed. There are parts of life is stressful. That's part of the human condition, is living with stress. But it's how do we manage it? What is stress that's normal? What is something that isn't normal stress? And how do we kind of manage stress? And that's actually where therapy can be really useful, of kind of figuring out what's normal stress, what's not normal stress, and kind of having some ideas around managing it.
One of our listeners wrote in and said that living with MS for the past 35 years, I find the greatest threat to my mental health has to do with profound fatigue. I'm going to chime in real quick here and say our last issue of Informed, the fall 2019 issue, focused on fatigue and has a lot of really great strategies and ways to think about fatigue. So I would definitely recommend checking that out as well.
And fatigue is such a challenging concept in and of itself. It can come from so many different areas. It's not just MS itself. MS can be a big part of it, but if you are feeling anxious or if you're feeling depressed, if you're not sleeping well, if your MS has progressed, those are all things that can contribute to fatigue. And so trying to kind of figure out what are the things that you can do, day in and day out that are going to be manageable, doable, and intentional. I think when we think about this, it's also really important. When we teach MS 101, we talk a little bit about, when we talk about exercise and how important that is for making new brain connections, we'd say it's not about going and running a marathon tomorrow. It's about what are the things that you can do with intention every single day. So it's maybe you're having a bad day and you can just walk to the mailbox and back that day. That's, being intentional about that being what you do to help with your exercise, your managing your fatigue, can be a part of managing that.
And you briefly touched on this, but one of our listeners is asking about family member stress of living with someone with MS, kind of that interpersonal relationships.
So I definitely think I often say this too when we teach our MS 101 classes, that from my experience and just from a lot of my clients that I work with, actually sometimes it can take a bigger toll on the support partners managing MS, because the support partners aren't in our bodies. They are not in the person's body who is living with MS. And so sometimes not knowing the unknown of it can be really challenging. And so that's where actually getting their own support, it could actually be really important and really beneficial of how to manage, how to live with, because also the support partners are also having to live with the unknown. They don't know. They might not know day in and day out what's happening. And there is some onus on the individuals who have MS to talk about and communicate with what they are feeling, what's going on. Even if they say, I'm feeling this, I don't know what this is, they're trying to be as clear as they can with communicating what it is that's going on and not being afraid to ask questions. Even though sometimes people get upset, it's being okay with asking those questions is important.
Are there any sort of supplements or anything that you would recommend for mental health? And I'll just real quick plug as well, we have a webinar specifically on supplements in MS. So if you're interested in that, I would check on our website. Holly Pren did a presentation on that specific topic.
So in terms of supplements with MS and mental health, there are things that are out there that people do. I personally don't know of any that are out there that are known. This would be probably more a question for a psychiatrist of things that are out there. Managing stress, exercise, those are things that are all important. Kind of looking at things from more of a holistic perspective definitely helps with managing MS, anxiety, depression. But medication can also be really important and really helpful as well.
Awesome, and I think that is all that we have time for today. I want to thank everyone for joining us, and thank you, Alissa, for sharing your knowledge. Be sure to check out the replay on our website, www.mscenter.org.